partners a couple of minutes to join, and then we'll get started. Thank you so much for being here. Salam, did you want to put up the training, or do you want me to do that? The PowerPoint.
I can do that. I can do it. No problem.
As Salam is putting up the training PowerPoint, we just want to welcome you. And once again, thank you for taking the time to join us today to focus on a very important event that the County of Riverside will be participating at the end of February, which is the Homeless Point in Time Count. And we hope that this training is useful in your participation in the sheltered count. So we have today two presenters, Mary Madsen and Salam Walker, who are part of the COC unit, the HMIS team. And I'm going to go ahead and hand it off to Salam so she can go ahead and get it started.
Great. Hello, everyone. I'm going to go ahead and share my screen.
We can see the screen.
Oh, we can see the screen. Okay. Maybe 1 second.
For those of you that joined a little bit later, we are recording this training, and we ask that you put your name and agency that you represent in the chat for attendance. Thank you.
Are you guys able to see my screen, the slideshow?
Yes, we can see it. Thank you so much.
Awesome. So hello, good afternoon, everyone. Welcome to the HIC and the Housing Inventory Count and Sheltered Point in Time Training for 2022 reporting year. My name is Salam Walker, and I'm a research specialist with the HMIS team. During today's workshop, guests will be muted, but please feel free to use the chat feature for questions or comments, or if additional clarification is needed, we'll do additional research and get back to you via email or meet via Teams for the clarification. And our HMIS team is ready to provide any assistance you may have during this webinar. Okay. We'll start by going over the objectives. The PowerPoint is designed to provide HMI's participating agencies an overview of the HIC and PIT count. So during this webinar, we'll go over the definitions of the housing inventory count and the point in time count. We'll also go over why it is important to collect the HIC and PIT count every year. We will also review the 2022 HIC and PIT data collection notice and review the changes for this year. We'll then go over the housing inventory spreadsheet that we'll be providing to you via email soon, next week. So this spreadsheet will, the demonstration we'll be providing today will allow you to know exactly what you need to turn in, as well as how to complete it accurately. We'll end our training with the reminder on important dates and information. Okay, so what is the housing inventory count and the point-in-time count? The housing inventory count is the point-in-time inventory of provider programs within a continuum of care that provide beds, units dedicated to serve people experiencing homelessness, and for permanent housing projects where homeless at entry. And per HUD's homeless definition, it is categorized by 5 program types, which are emergency shelters, transitional housing, rapid rehousing, safe haven, and permanent supportive housing. The point-in-time count is a count of a sheltered and unsheltered people experiencing homelessness on a single night. HUD requires that continuum of care conduct an annual count of people experiencing homelessness or sheltered and emergency shelter and transitional housing on a single night. Now we move on to why it is important to conduct the point-in-time count. As I said in the previous slide, HUD requires that the HIC and PIT count to be counted annually for each COC. In addition to the HUD's requirement, it is required to continue receiving federal funding for homeless programs used to develop strategies to end homelessness. It also plays a critical role in the COC program competition, and HUD will continue to emphasize through its scoring the significance of the data reported, as well as the process for the data collection. And the other reason is the state homeless funding allocation is based on point-in-time count data. And it's also very important that we conduct this count because it will continue to provide critical updates on national and local progress towards preventing and ending homelessness. So it's very important for us to provide an accurate data for these reasons. We'll now move on to the 2022 HIC and PIT changes according to the 2022 data collection notice. We're only focusing on, there are different, multiple changes to HIC and PIT, but we're only focusing on changes that pertains to our COC. So one of the changes that applies to our COC is that HUD added a new funding sources to reflect since 2019 data collection notice that was released. So under the HUD McKinney-Vento, we have the Youth Homeless Demonstration Program and ESG funding program. And under federal funding, we have additional funding sources that have been added to the housing inventory count. So these are HELPA, home, emergency housing vouchers. HUD also released a new data field on the HIC called Comparable Database Participation. So this database is designed for organizations that are for victim service providers. This data field will allow us to indicate whether VSB organization is participating in comparable database. I also, a link is included here if you need more information on this comparable database participation. You will be able to, it's called, this link is designed by HUD, and it's called HMI's Decision Tree for Comparable Database that provides additional information if a project should be in the database or not. The other change on the PIT count is that for veteran households receiving temporary housing assistance through VA Supportive Service for Veteran Family Emergency Housing Assistance, or SSVF, on the night of the count, we'll count those veteran households as residing in emergency shelter and include them in the sheltered count. This is per HUD guidance. Therefore, these clients who have received temporary housing assistance through SSVF EHA project will be counted as an emergency shelter when counted on the point-in-time count. I will now pass it over to Mary Madsen, who will be going over the housing inventory count demo. Thank you.
Hi, everyone. Salam, next slide. Okay. So what to include in the count, in the HIC count? Include only projects with beds and units dedicated to serving homeless persons, meaning the primary intent of the project is to serve homeless persons. The project verifies to homeless status as part of its eligibility determination. The actual project clients are predominantly homeless. Beds and units in the HIC must be dedicated to serving homeless persons or for permanent housing projects dedicated to persons who were homeless at entry. Next slide. Okay, the types of projects that we include are emergency shelters, transitional housing, and permanent housing projects, including the permanent supportive housing and rapid rehousing projects. Next slide. Now we're going to go into a demo where I'm going to show you what we're going to be sending out after the HIC, the night of the count. We'll be sending this out to everybody so that you guys can verify the information. We pull this from the Clarity system. We'll also, within the next week, be sending you an additional 2 spreadsheets, and these will help you to identify clients that are missing head of households. Am I sharing my screen? I should have checked that first. Yeah, okay. It's going to provide you the information for clients that are missing head of households. That information will need to be updated prior to the count. This is what the HIC inventory count from Clarity looks like, and we'll pull it for the night of the count. I just kind of did a sample here. Additionally, this week we'll be sending you a list of clients that are missing move-in dates. For our PSH and rapid rehousing projects, a move-in date is required for them to be counted because we have to identify that they have actually moved into housing. On the bed inventory, the project ID is going to automatically populate where it's going to be on the spreadsheet. The project type will be there, and the organization and the project name. For the geocode, at the end of this PowerPoint presentation is a link that will actually provide you with the information with the list of all the different geocodes available per HUD. That must be updated annually or reviewed to verify that it is still currently accurate. And the geocodes should reflect the locations of the project's primary location. So if you have multiple sites for your facility, it would be the site that serves the most clients that you would use the geocode for. The next field here is the target population. The target population is a population that is designed to serve at least 3/4 of the clients served by the provider in 2 different categories. These are going to be your DV providers. If 75% or more of the clients served in that project are domestic violence victims, we would report that there. Additionally, if it is an HIV project that serves mostly clients that are HIV, then that would need to be put there. For most of our projects, it's going to be not applicable. That's just our standard, most of our projects, what they would be. For McKinney-Vento funding, if the project is funded by either ESG, HUD COC, Shelter Plus Care, or Section 8, then those would be qualified under McKinney-Vento, and the response here would need to be yes. For other federal funding sources, those are going to be your VA benefit, VA services, your Health and Human Services RIE funded projects, your HOPA funded projects, and your public and Indian housing programs. Now, under inventory type, there's 3 options. The first one is C, which is current inventory. And that one is for any inventory that was available during the night of the count. For new inventory, it's any new inventory that has been added since January of the year of the count. And for if the beds are under construction or the facility is under construction or under development, then it would be U for under development under the inventory type. And then we get to the bed type. This is for emergency services only. And for the bed type, it's going to be either voucher bedding, facility-based, or other. And those are only for, like I said, emergency services. On the HIC and inventory count, we're going to have this section where agencies will need to verify that the data that we pulled from the system reflects the correct number of beds and units. HMIS beds would be beds that are not dedicated to any of these 3 populations, either veteran, youth, or chronic. We have the with children, so this is any household with children, and you need to verify that the beds are listed, the total number of beds on the night of the count, the total number of units that those beds are in, and then the HMIS beds would be any beds that are not dedicated to one of these 3 populations here. The same thing goes with without children. You're going to identify any beds that are designated for families or for people without children. And then those are going to be non-dedicated beds are going to be under HMIS. Beds that are dedicated for any of these 3 specific populations will need to be identified here in these columns. For households with only children, because we do have some projects that do serve children, those would be listed here. And this information is all going to populate from the system. So whatever we have in there, it's really important that the data quality is up to date and current, because the system is going to pull it from what you guys have in our system. Seasonal beds. So the seasonal beds are not available year round. They're usually beds that are only open during certain times of the year on certain dates that are specified based off of the project. Those would be like, I know that we have a couple of emergency shelters that are only open during like the summer when it's too hot or during the winter when it's too cold. And then we have the overflow beds, which those are designated for emergency shelters usually. And the overflow beds are available on an ad hoc basis, and they're when the demand for beds exceeds the number of planned year-round beds. And so those would be reported here. And then the total number of beds is going to add up all of these total number of beds to identify how many beds your facility had on the night of the count available. And then the PIT count is going to identify anybody that was served on that night of the count. The PIT count is really important that we look at that number when we send you guys that, because when we run the reports, if this doesn't match what you guys record as far as having in the system, as far as who you served, then there's something going on and you need to let us know that this number does not match how many people you say you served that night, because we'll need to go in and find out what's going on. Like I said, within the next week, we'll be sending out spreadsheets that identify people who are missing their move-in dates for PSH and RH projects. Those are essential in order for us to count those individuals. So we'll send you a list and let you guys know that, hey, these people are missing. We'll also be providing you guys with the list of clients that are missing the head of household, because that will need to be identified. Otherwise, those individuals may not be counted on the night of the count. And we want to try and include everybody on the account. So the more accurate the information that's in the system, the better we'll be positioned when we go to run the reports and submit to the state. Let's see. This is kind of what the report will look like when it's the households that are missing move-in dates. For RH, for PSH, it might look a little bit different because the system populates this one. We'll have to actually pull the PSH projects for their households that are missing move-in dates. And that is basically how it's going to work. That's the spreadsheet that, like I said, you guys will be getting. And the most important thing is that agencies have 7 days from the date of the count to enter in client information. So it's really important that at least all of your information is entered in and current 7 days after the count, because that's when we'll start pulling the information and verifying the accuracy of the data that's in the system. Okay, Salam, next slide. Okay, so some important dates to remember. The night of the count, Riverside County will be conducting the HIC count and shelter PIT count on February 22nd, 2022. Data entry is due. So as you all know, or as most of our agencies know, data must be entered in 7 days. You have 7 days to enter in the data for clients that are served. And so all the information must be entered into the system by March 2nd, 2022. Finalized HIC and PIT spreadsheets are due March 10th. Those will be sent out the first business day after March 2nd. And so you guys will receive those. And like I said, we're going to be sending out within the next week the list of people who are missing head of households and the ones that are missing move-in dates. Thank you, Salam. And we'll be sending those out this week, because the idea is if we can start identifying those clients now and get that information in, it'll be a little bit easier for you guys to make sure all the information is correct in there by March 2nd. And so those dates that we need to remember. And you guys will be getting emails from us. We'll be sending this out, and hopefully we can have a great HIC and PIT count for 2022. If you guys have any questions, please send any questions to HMIS support@RIBCO, or you can reach me at my phone number. It's listed on the PowerPoint, or Salam or Miguel. Any of us within the HMIS will be glad to help you and answer any questions. We know that HIC and PIT can kind of be a busy time of year, and we're here to help any way that we can and make sure that you guys receive the support and responses to any questions that you have regarding the HIC and PIT count. And this slide just covers the resources. So we have the 2022 HIC and PIT data collection. The link is there for that. We also have the PIT count methodology, which provides additional guidance. And then the list of geocodes can be found on the link, the last link on that page. And we are glad that everybody was able to make it. And I'm sending it back over to Salam.
Thank you, Mary. Do you guys have any questions or comments? If there are any, let us know. Okay, great. If there are no questions, we'll end our meeting here. I will have the recordings available, so we'll send the PowerPoint as well as the recording to you, so you have it in hand. And if you have any questions, feel free to reach out to HMI support or give us a call. We'll be, we're here to help, so anytime. And thank you, and have a great day.
Thank you, everyone. If you wouldn't mind, make sure that you did enter your name and your agency in the chat for attendance purposes. Thank you to Salam and Mary for providing this information. We look forward to working with all of you and your agencies to ensure an accurate sheltered count for 2022. It's a HUD requirement, and we want to do our best to make sure that the numbers reported for Riverside County are accurate. So we appreciate your time and effort in advance to helping us meet that. Have a nice day, everyone. Thank you.